Now that we've laid the groundwork with a Medicare overview and eligibility and enrollment, in this lesson I'll dive into original Medicare, what it is, how it works, and more importantly, where it falls short. Remember when we covered the parts of Medicare back in lesson 1? Well, A and B were actually the first parts of Medicare when it was made in 1965. And because they're still around today and they make up the bulk of what Medicare is, we call those original Medicare. So parts A, hospital, and B, medical, are called original Medicare. And just to give you a reminder of what those are, part A, hospital, is inpatient hospital visits, inpatient mental health, skilled nursing facility, home health care, and hospice care. And part B, medical, is outpatient hospital visits, physician visits, ambulance rides, laboratory, blood work, things like that. So when you turn 65, original Medicare becomes your primary healthcare insurance, unless you or your spouse continue working past 65 for a large employer. But here's where it gets interesting. Original Medicare was only designed to be essential coverage, not full coverage. This means original Medicare is only put in place to make sure you're not going to become gravely ill or die. It's really just covering those essential healthcare basics. And when your healthcare only covers the basics, there are gaps. So what do these gaps look like? So original Medicare, parts A and B, only cover 80% of your medical and your hospital expenses. And you'll see at the bottom, it excludes drugs, dental, vision, hearing, and other benefits you might want. So what does that leave behind? You would cover 20% of all your medical bills. And when we're talking hundreds of thousands, if not millions of dollars in medical expenses for catastrophes, 20% could break you financially. Not to mention, you'd be stuck paying for all of your drugs and all extras that you may want. So because these gaps are so large, the government told private insurance companies, I want you to fill those gaps. So in 1992, we came up with supplements, which work alongside original Medicare as standardized plans. We'll get into that later. And then in 2003, we came up with Advantage plans, which completely replace original Medicare and is the privatized version of original Medicare that actually bundles in things like drugs and extra benefits. But we'll dive into those later, so don't worry about that now. So these are the two ways that you can fill the gaps in original Medicare. These are your two options. But it's important to know that you can only enroll in one of these two options if you already have parts A and B, which make up original Medicare. So that's order of business number 1 is getting enrolled in parts A and B, and then we can dive into filling those gaps. So in the next lesson, we will dive into those gap fillers, and I'll cover option number 1, which is adding a supplement plan, also known as Medigap. If at any point during this course you feel confused and you want expert help with your Medicare, Braden Mosley, am a licensed Medicare insurance broker. I'm actually trained and certified with some of the top insurance providers in the country. Companies like United Healthcare, Health Alliance, Humana, Aetna, Blue Cross Blue Shield, and Wellmark. And if you decide to work with me, there is never a fee for my service. I'll explain why later. I'm only paid if I keep my clients, which means that your satisfaction is my priority. I offer face-to-face, year-round service. So if you want a free intro call with me, click the Meet with Braden button on the screen. Otherwise, go ahead and click the other button and continue to lesson number 4.